The United Kingdom this week will start rolling out COVID-19 vaccinations as its plans to distribute the Pfizer-BioNTech vaccine and carry out immunisations on a broad scale are moving ahead as expected. US state authorities are also preparing local hospitals for the first shipments of the Pfizer COVID-19 vaccine if the US Food and Drug Administration authorises it, possibly as early as mid-December. This is all quite encouraging news as global coronavirus cases crossed the 66 million mark, while deaths have surged to more than 1.52 million, according to the Johns Hopkins University on Sunday local time. We discussed these developments today, what kind of developments experts are hoping to see, and also what precautions are needed as the fastest developed vaccines in history start being administered outside the lab. I'm joined by Bharat Pankania, Senior Clinical Lecturer at the University of Exeter Medical School with more than 20 years of experience in communicable disease control and infectious disease management. We also welcome back Dr. Bruce Wiley, Professor of Health Policy and Management at City University, New York, who is a systems modeler and a senior contributor for Forbes. Thank you both so much for joining us today. We're going to start with Dr. Pankania. Now, over there in the UK where you are, the final checks were taking place on Sunday as the UK gets ready to distribute 800,000 doses of Pfizer's COVID-19 vaccines for over 80s, including the Queen and Prince Philip, and the most vulnerable to the disease, including health workers. Now, it's a very big moment for Britain, but there has been some scepticism. America's Anthony Fauci told Fox News that the UK did not review Pfizer's data carefully enough before approving it. I mean, of course, he did later apologise, but what do you make of his remark, and what made it possible for the UK to really dissect the data and decide on rolling out the vaccine so quickly?
So I would look at it as emergency preparedness, and by being prepared that you were going to get a huge tranche of data from the Pfizer-BioNTech vaccine and its safety profile, its performance profile, and all the other different sectors from the experiments carried out by Pfizer. So what you do is you have subsections of your committee all prepared and ready, and you prime them with all the tools, all the support systems and everything at the ready, and all the briefing papers, so that when the real thing arrives at your desk and the real chapter, because no one member of the committee is going to read all the chapters, they're only going to be reading and pronouncing on a small sector of all the other chapters together. And this way, if you pre-plan and prepare, it is entirely possible to produce a report, and a report which says we wish to license it in record time. I don't think the Medical and Healthcare MHRA, that's the authorizing body in the United Kingdom, has cut corners. I hope not, and I expect that they will have done a diligent job in getting this done as soon as possible.
And now, Dr. Lee, because this was just a massive amount of data, US officials did expressed some concern over whether it was reviewed properly, including your Dr. Anthony Fauci. And well, why is it that, well, the UK is ready to start administering Pfizer's vaccines this week, but the US had the data as well, but why is it taking a bit longer over there?
Yeah, there is some concern with both the US and the UK that things may be moving a little too quickly. If you look at the Pfizer trials, they really didn't start until around summertime, so there's only really a few months of data. Of course, with every passing month, there's more and more data that's added. But the question is that long enough to really assess the efficacy, the duration of protection, and the safety of the vaccine? We have to keep in mind that this is not a sprint, it's a marathon. So being the first country or the first population to receive the vaccine is not really the goal. The goal ultimately is success of the vaccination program, and not just within a particular country, but across the world. So the question is whether we really need to have patience in terms of making sure that everything is in order, because we're in a situation where, if there's a misstep, then that could potentially set back the vaccination program months or potentially longer than that. So, a lot of people in the public health and the scientific community are urging caution. And so the question is, can we all make sure that we're taking the steps deliberately and carefully and not bowing to political pressure to make sure vaccines get out as quickly as possible? That really shouldn't happen. So we all want to be careful about this. And we also want to make sure that enough of the medical scientific community can actually review the data. Certainly, there are people in the regulatory bodies that will be looking at it, but the more the people that can lay eyes on it.
We're expecting your officials to review the Pfizer data as soon as this week. And well, Dr. Pankanya, there are a lot of logistical challenges to distributing mRNA vaccines like the Pfizer ones. And does the UK have a system ready for distribution? And also, how do you think authorities should really monitor for the possible side effects or the things that could go wrong in this process?
Yes, so if I may, first of all, concur with my colleague, Dr. Lee's comments. I entirely agree with him that caution is important and also that this is not a marathon. This is a global effort in protecting people in your country and other countries as well. So moving on to the logistics of delivering this very complicated vaccine. It's complicated, it's good if it works, and I assume it works. So it has to be kept at minus 70 degrees centigrade. That is super cold and super difficult to achieve unless you have specialist refrigeration. So what we are doing in the United Kingdom is we have 50 hubs with these specialist refrigeration units. So the vaccine arrives into the UK from Europe, from Belgium, and then it is taken in cold storage, maintaining the cold stand and tracking that it is always been cold and always at the right temperature. And then it is stored at 50 different hospitals scattered across the United Kingdom. And that will be the headquarters for starting off the immunization programs from the hospital setting in the first instance. So I expect elderly people, vulnerable people, healthcare workers will first start to be immunized from the hospital settings, and thereafter the program will move to the community and community hubs where they can also safely and securely immunize other people.
Well, it's a massive mission, and well, your health secretary has called it V-Day, and we really all hope that it goes well. And Dr. Lee, in terms of getting the vaccine, as more and more countries are looking forward to actually receiving the shots now, when we get our annual flu shots, we normally get that one jab, and that day we might expect to feel slightly tired or poorly. Will getting a COVID-19 vaccine be different from getting the flu shot? I mean, what kind of procedures and possible side effects should we expect to experience?
Yeah, we're talking about the possibility of 2 doses, so 2 doses administered separately. So the first dose essentially will prime the immune system. It gets an initial reaction, but the question is how long will that reaction last? How long will that protection last? So the thought is giving a second dose would then extend that response and ultimately extend the duration of protection. So that raises some logistical questions or issues, because if someone gets their first dose, they later have to return for the second dose. So that makes things a little more complicated. In terms of reactions, typically when you do get a vaccine, you'll get some types of symptoms, because that shows that basically the immune system is responding to the vaccine, which is ultimately what you want to do. Now, the severity of that really depends on the vaccine and how the immune system responds. So typical, for instance, when you get the flu vaccine, you may feel some fatigue, you may feel slightly warm or tired or something of that sort. So the question is with this vaccine, whether you'll get some of the symptoms that are similar to COVID-19, but of course a lot more mild. That's something that we'll have to see, and it really depends on what the data looks like, and it also can be highly dependent on the person. So you can give the same vaccine to 10 different people, and you can get 10 different reaction. Now, I want to make clear that there's a difference between sort of an initial mild reaction and adverse reaction. So, of course, one of the things that everyone wants to be careful about is making sure that there aren't an unusual number of adverse reactions. Nothing is 100% clear of adverse reactions. There's always going to be some people that might get some bad reactions to anything, regardless of what you give to them. But the key is to make sure that that's not unusually high, and that those reactions can be dealt with very quickly and identified and dealt with very quickly. So those are things that need to be measured very closely, both in the trial, but also when it's actually being rolled out. So there needs to be a system to really track all these things so that officials, public health experts can really see what's going on and make any alterations in case needed.
And Dr. Pankanya, when do you expect most of the UK's population to have been vaccinated? And does that mean fewer transmissions will occur? I mean, I think the question we want to know, we all want answered is whether we can stop wearing masks and social distancing.
Yes, so if I just continue first with Dr. Lee's comments on safety and efficacy, I really also want to say that when we start immunizing over here, we are going to have a surveillance system of all the patients. They're not patients, people. So all the people who have been immunized, we will make a note of them and then follow up a large representative sample to see if they are developing any unusual, unexpected, severe signs, symptoms that we had not thought of or expected. So in answer to your question about once the immunization program gets going, it all depends on how well it works. And what I mean by it works is how well does the vaccination protect from infection and cutting down and removing the chain of transmission. So first you immunize and then you see how well the vaccine is performing. So if it performs very well and we get a large population and then we find with our community surveillance that the level of circulating virus in the community has dropped significantly such that it isn't in free circulation, you can start to relax your infection control measures. I personally feel it would be a good idea to continue with infection control measures, your distancing, your being careful of crowded places, you wear your mask, you wear it properly for some time to come, because it is a good preventative measure until we are absolutely sure that the virus is not out there in circulation. So one more thing I just wanted to add is we don't know if, for example, these vaccines may give you a mild infection but protect you from severe illness. So if it gives you a mild infection but protects you from severe illness and death, then you can also be infectious but immune. And under those circumstances, we need to be aware of it and continue to undertake good infection control measures until a large number of people, over 70%, have been immunized and the circulating level of virus, therefore, in the country is at a minimum low level.
So we still need to wait and see how well this works and whether people stop being infectious, I suppose. And
yes.
Well, Dr. Lee, your study results published this summer suggest that if 75% of the population got the vaccine, its effectiveness would then have to be around 80% to actually stop an ongoing epidemic. But even with the vaccine rollout, the US is projected to report 539,000 coronavirus deaths by April 1st, according to the Institute for Health Metrics and Evaluation at the University of Washington. What are the most important steps the federal government should really take to prepare and minimize the cases of infections and deaths over this winter?
Yeah, we have to keep in mind that the vaccine is part of multiple layers of interventions, policies and interventions to prevent the spread of the virus. So you may have seen the representation of this as Swiss cheese, where you have multiple slices, that each intervention and policy has its holes and its deficiencies and also this trend. So we need to continue to do social distancing. We need to continue to have face mask use, disinfection, and finding ways to really continue to do contact tracing and ways to box in the virus. Not just before the vaccines arrive, but we have to keep in mind several things. So one is when the vaccines do arrive, there's no way the entire population is going to be vaccinated immediately. So it's going to take time. And it's going to take time for several reasons. One is there's going to be production challenges. So it'll take time to actually produce the vaccine. It'll take time to actually distribute and supply the vaccines to different locations. And ultimately, it will take some time to get different proportions of the population vaccinated. So this is all going to take time. So all during that time, and before that, you need to continue all these other interventions, and then potentially for a while after. So we have to make it very clear that the vaccination is part of the response to the pandemic. It is a very important, absolutely there's not a replacement for a vaccine, but it's still one part. So we need to continue and actually step up a lot of these precautions. Otherwise, we're going to be in a situation where the virus will be very widespread and it'll be harder to control.
So really, the vaccination doesn't mean it's the end, it's just a part of it, as you said. And well, Dr. Lee, now, before we go, we want to talk about the other efforts being made to start vaccinations. And well, Russia has also started injecting people with Sputnik 5, claiming a 95% efficacy rate. But there are still questions lingering over the efficacy, and Russia's polling agency in a recent survey found that only 36% of respondents were prepared to be vaccinated. So first of all, how does this two-part adeno, excuse me if I'm not pronouncing that correctly, vector vaccine work, and what kind of evidence are skeptics looking for from the Russian vaccine?
Well, we really need to have a situation where there's extensive data sharing amongst around the world, because this is a global problem. This is the global issue. So if the virus is continuing to spread in parts of the world, then everyone's at risk. So we need to all work together to really understand which vaccines are the best to use and with which populations. So that really entails more sharing of scientific data when it comes to all the vaccines. So including the Sputnik vaccine. So we're hearing pieces of information here and there, but what we really need to see is the overall data, and not just general efficacy or general effectiveness of the vaccine, but detail, like what is the effectiveness or efficacy of the vaccine among different types of subpopulations. People of different ages, people with different comorbidities, people from different situations and different degrees of infection, and how effective it is in not only preventing infection, but preventing more severe disease, decreasing how contagious you are. These are all details that we really need to know, because each of these different vaccines might have different qualities and characteristics, and therefore be targeted better to different populations. So there really needs to be a more data sharing to basically assess the value of these vaccines and how they can be used. I should also add that, again, emphasizing that control of this virus has to be global. So it's not enough to control the virus and vaccinate populations within particular countries or countries that can just afford the vaccines. Everyone needs to get the vaccine. Otherwise, if the vaccines are not distributed around the world and the virus is not well controlled, then every country is at risk. So if you may protect your country, but if it's circulating somewhere else, it could always come back to affect you. So we really need to have more global coordination. It's very difficult to make assessments about any of these vaccines without actually seeing the data. And the data also needs to be published in peer-reviewed scientific journals so that we can actually see that what it looks like and make our quality assessment. Because it's very important to assess the quality of the studies that are being performed to make sure that everything's in place.
Right, so we should welcome any development on an effective vaccine. And earlier I said the Russians claimed a 95%, but it's actually a 92% efficacy rate that they claimed. And Dr. Pankania, well, a lot of middle income and developing countries and countries including South Korea, they're pinning their hopes on less costly vaccines like the Russian and Chinese candidates, but mostly AstraZeneca. There has been some controversy surrounding its results, though, and but then your Health Secretary Matt Hancock said it could be ready by Christmas. What will be the next steps for the Oxford AstraZeneca vaccine developers?
So with the AstraZeneca Oxford group, they conducted their experiments in a slightly different way. Instead of having one large trial encompassing all the age groups and all the comorbidities, etc., they did slightly different versions of the experiments in different groups. And therefore, this subgroup analysis of the data is going to require some complex and expert mathematical tests and analysis, something well beyond my capability. So we need to see how well their data stacks up with respect to efficacy, safety, reproducibility, and I expect that behind the scenes, AstraZeneca, Oxford Group, right now as we speak, may be conducting additional experiments and additional trial work just to strengthen the quality and quantity of their data, because they appeared to have done their trials in a what we would call multi-armed, multi-patchwork type setting rather than one great big trial. So that's going to take time.
I'm afraid
Having said that, I think it will work. I think the premise of Sputnik 5 and AstraZeneca Oxford one is very similar.
Well, I'm sorry to have to cut you off there, Dr. Pankania, but this is where we'll have to wrap up the discussion for today. That was Dr. Bruce Wiley and Dr. Bharat Pankania joining us from New York and Bath in the UK. Thank you both so much for your time today.
Thank you.
And to our viewers, thank you as always for watching.